Good day, everyone, and welcome to the fourth of the FEPRIN webinars. It's great to see so many people with us today. One thing I'd like to mention at the beginning is it would be great to get your feedback, particularly those of you who've been to more than one of these. So if you have views about how these are going or how we could change the format, ways in which we could do things differently, that would be really great. It'd be great to hear those. From our end, it seems to be going well, but we'd love to hear your views about that, and we'll take those into account. Before I introduce our speakers, I just want to say, so everyone knows, that this webinar will be recorded. So you'll see the recording button up on the corner of your screen there, and it will be uploaded onto the seminars page in the next few days, and a notice will be sent out about that. When you go to that website, you'll see that there are also a lot of resources related to COVID that you might be interested in looking at. So please do go there and have a look. If you have a chance. During the course of this, excuse me, during the course of this webinar, it'd be very helpful if you could have your microphone on mute during the talks, and so we get a good sound quality. And if you have questions to ask of the speakers, please can you do that in the chat function that's available on this platform. And it's really important when you do that you select, when you type it, you select to all participants and attendees so that everyone actually gets to see that. So you need to just make sure it's addressed to the list as a whole. So I think that's probably all from me now. I'm going to do my best. I suppose the other thing to say is there are a lot of people on this call, so there are going to be a lot of questions. I'm going to try my best to capture those, but I'm pretty certain I won't be able to get all those questions asked. But I'll make a selection. I'll do the best I can. We'll copy the chat at the end, and maybe we'll try to turn that into some kind of use some of those ideas for a blog. So comments are always really helpful, but I'll do my best with the questions. So without further ado, I'm going to just introduce our three speakers, and then we'll get started on the topic. So we have three great speakers with us today. The first of our speakers is going to be Professor Zeng, who's the director of the Research Center for AI Ethics and Safety at Beijing Academy of Artificial Intelligence. Our second speaker is going to be Professor Effy Vayena, who's the chair of Bioethics, Health, Ethics and Policy in Switzerland at the Swiss Federal Institute of Technology. And our third speaker is Professor Joseph Ali, who's assistant professor at the Department of International Health, Johns Hopkins, Bloomberg School of Public Health. I won't give long introduction to everyone because I'm sure you all know about them already, and they're very esteemed colleagues. So what I'll do immediately now is hand over to Yi to give the first talk. Yi, over to you.
So can everybody see my slide now?
Yeah, perfect.
Okay, nice. It's a great honor to speak to you guys and to all the audience in here. My topic for today is going to focus on the data and AI governance for COVID-19, especially with perspectives and observation from China. I'm from Beijing Academy of AI and also Chinese Academy of Sciences. So briefly, I would like to say that, well, because the topic for today is digital technology ethics for COVID-19 pandemic. So there are many ways that you can use big data analytics and artificial intelligence to fight against COVID-19. For example, for spread prediction or for city imaging recognition, and also for automated surveillance. And I would like to say that for each of them, they have very different ethical challenges. So I would like to, but more focusing on the automated surveillance for today. But to name a little bit few more is that, let's say for drug discovery, that when you're using knowledge representation reasoning, maybe the knowledge is not really trustworthy. So in this case, the reasoning is not really trustworthy. So you have to validate the knowledge. So there are many different technical and ethical challenges, I would say. But for automated surveillance, that for now, I think the pandemic is just changing the system of the public health. I would like to say that for responsibilities and accountabilities, it's not only about doctors and patients anymore. It's about different levels of governments. It's about AI companies, community and block staffs, gatekeepers, volunteers everywhere. So now we're having all of them, but actually they're working very hard. We would like to thank you for the efforts that they're having, but clearly they're not really all of them that are behaving according to the current policy. Let's say when the outbreak actually happens in Wuhan, actually there are personal information just to post on WeChat saying that, oh, maybe these students coming back from Wuhan is really dangerous, so we need to be care about them, to take care of them and be care about them. This is, of course, a very bad story. And then you found that in Tianjin that they reported 7 prevention and control apps violation for personal data collection. A very different type of challenges for ethical considerations. And then like I said, much more stakeholders have access to the personal data now, but are they really taking the responsibilities to control and release the use of these data? No, they're not. So for example, in Shanxi, that leaking the personal privacy of closely interacted person have been given an administrative punishment. And also in Hunan province, similar things are happening. So the story happening in China is that we have a multi-ministry reaction mechanisms exactly at the time these happens. So centered by the Cyber Administration of China, the Ministry of Transportation, Civil Affairs, and Health Commission, and also Ministry of Industry and Information Technology, who is taking care of all the AI companies that are actually involved. I'll leave some message in here for discussion, but let's focus on only one of them, that the 4 ministry agreed that to release something called together called the Information Construction and Application Guidelines for Community Prevention and Control of COVID-19 outbreaks. Right there, they say that the need to collect information in community residents should be clearly prompt that the community resident obtained consent, clearly used for prevention and control of the, if it's used for other purpose, must be reobtained consent. So basically, this is from the national level, but at the local level, let's say in Tianjin and Hong Kong, they have their own policies released. Overall, for now, we have more than 216 countries that have confirmed cases for COVID-19. We're now at least 63 countries and regions actually have published privacy-related guidelines, I would say. But of course, everybody needs that. So I'm gonna focus more on specific cases for now. Is I would say augmented facial recognition for public health. Right there, actually, we did a survey with more than 1,000 participants from China, mostly from China, where we have some other people from 10 other countries who are Chinese users, basically. Actually, all the users are actually from every provinces and places from China, as you can see. There's a report where we can share on the slide. And then I would like to give very brief introduction about what we found is that, well, at least in China, that people say that for the facial recognition technology, they can be effective. They believe that they can be effective to help to cope with the public health crisis. And then they feel that now they're clearly aware that the positive effects of facial recognition technology is responding to public health crisis. Most of them feel that. I think this is good because if you are having a technology that is useless, well, in this case, this is really challenging with additional ethical considerations. But there are things are changing. Well, we're always asking the question, how can we go back? So actually, it seems not quite. So let's say that for this question, in order to prevent a similar emergency outbreak after a public health crisis, the collection of facial information in public space should be continued. Well, that many people agree that. What that means, people are actually scared. So they wouldn't like similar things to happen. So they say that, well, you can continue if this could happen again. And then, but when you ask a very different question, let's say after public health crisis, the application of an unnecessary facial recognition should be reduced. I would like to be, well, 100% of them would like to agree, but actually there are only 70% who says that agree, while 27 of them says neutral or disagree, or even strongly disagree. What that means, like I said, people are scared, people have worries whether we're really having a safer or safe enough atmosphere. Well, that's something we're not really imagining. So I would say that this is challenging. So if you are interested in the question themselves, you can have the Google form in here. Now I'm gonna focusing on a health code in China, because it's very different that for the health code in China, like you see in my slide, the facial recognition is part of the health code, that it uses your facial data to verify, oh, okay, this is exactly you. So well, in this case, we're actually showing the Beijing health code right in the left. Right here, you see that at the bottom, it says it was developed by the Beijing Big Data Center. Well, that's kind of a center from the Beijing municipality. So for now, actually, there are technical corporations who are involved. Let's say for Tencent and Alibaba, by Tencent, they use WeChat as a foundation to develop this kind of, to support the health code. In this case, multi-stakeholder responsibility and accountability has to be for governments and for industries. So it's not only about industry in China, it's about government and AI companies. And something which is special in here is that it is associated with my national ID, but not my cell phone. Well, in this case, if the record will not change when I change my cell phone. So we know that there are many shrines which use a cell phone and to do decentralized storage, but for this Chinese shrine, actually it is decentralized, but not really on your cell phone. It's in multiple centers. We do have another shrine, which is a National Integrated Government Service for Pandemic Prevention Health Information Code. But actually, that is not really required. So like you see here, they say that you can get it now, but I prefer not. So I just need my Beijing health code if I don't like that for now. So I cannot share too much detail for the national one, because I think me personally, I don't really need that for now. And I don't like it to share too much information. I want to discuss the future in here, which is I would like to say very serious. That is, never try to use the collected information from COVID-19 pandemics for other purpose without any informed consent. In Hangzhou, in China, they're having an idea that maybe this kind of health code can be extended so that it can actually to have a continuous observation on your health status. I think that's a crazy idea. Let's say that for the picture showed in here, they say that they could record your physical exercise, your drinking, smoking, or even sleep. I think, like I said, this is the potential abuse of health code for COVID-19. If it is associated with the health code for COVID-19 and related data, it is the worst idea on AI application that I have ever heard of. So people say that, oh, it should only be for COVID-19 period. So you cannot say this is a health code in normal cases. And then people also say that clear division, in China, clear division should be made to personal information and public health. The health code is designed to be observed by other people, but actually my personal health record is not. So people are crazy about this idea in a very bad way. So in that case, the local Ministry of Health says, oh, we only have an idea, we're not going to launch it. Okay, luckily for now, they're not going to launch it, because actually it is going against what I said for the four ministry coordinated principles. The need to collect information, need a new informed consent if you like to use it, and never use this data in COVID-19. So I'm going to discuss what kind of AI are we creating for the next generation. Like we discussed just now with the speakers, that today marks the International Children's Day. But now we're having this kind of augmented facial recognition and emotional recognition in the classroom. And now we're having health code for life. I think that's a crazy idea. It's not only about the technology, it's really about how this kind of technology is changing the next generation. So when you grow up as 18, and then you say that, okay, this is the AI that has been having an eye on me for 18 years, and now you're having me to choose it as a profession. No way, no people will actually like it. So I was thinking that the facial and emotional recognition in the classroom, both in China and the United States and many other countries, is the worst idea. But now I think that health code adopted from the COVID-19 as a continuous service is actually the worst idea. So, and then people would like to say, I can actually create a technology that will save us from AI surveillance. So you see that this kind of a weird atmosphere has actually emerged from technical side. We do, I'm finishing. We do have ethical considerations from COVID, from WHO. My colleague Effy and also Michael and also me has been involved. Here I'm only mapping the domain independent AI ethical principles with the WHO ethical considerations. Effy will have a final introduction, but I would just like to bring your attention that this kind of consideration do cover human-centeredness for human, transparency, privacy, security, safety, and accountability. Finally, I would like to say we should always keeping AI as assistant, not really making decisions for COVID-19 is really essential in any circumstances. Thank you very much.
Thank you very much, Yi. That was really, really interesting. And can I just remind the people who are attending this, if you do have questions, please do put them in the chat line, because it'd be nice to come back to this at the end. We won't take questions between the speeches, between the talks though. So what I'll do now is hand over to Effy, who's going to speak next.
Thank you.
Without slides, sorry.
I am going to keep your attention without using slides. So I'm going to give it a try. Before diving into some issues that I think are important for this conversation, I just wanted to start off by making reference to the guidance that Zee just referred to. That's the interim guidance that WHO published on the ethics of digital proximity tracking. So that's one of the technologies that have been proposed as solutions for the in the response against COVID-19. I should say also that I had the privilege of chairing the group that worked on this guidance, and I very much hope that those working right now, all those actors working in developing such technologies or deploying them already, they will find this guidance document helpful. Clearly, this is uncharted territory, given not only the novelty of the digital interventions that we are talking about, also the size of the pandemic, the fact that we were not just very prepared to have those technologies ready to deliver. So we find ourselves with challenges for which there are no off-the-shelf solutions. And I think that the guidance that WHO, the group at WHO worked on, was to try to help people deal with some of these challenges. So the guidance, and I think Catherine will be sharing the link to the document. The guidance identified several principles that should be respected, and it took into account first the current public health goals, the urgency of the matter, the necessity to respect and protect human rights and ethical values, and of course the distinct challenges that the digital in general is putting in front of us. Now, the spirit of this guidance, at least the way I experienced it in being at the meetings, and hopefully it came through in the document as well, was not necessarily one of hard trade-offs, either or. It was rather in the spirit of optimizing for all values that matter to all of us. A lot of recent commentary, public discourse, and even some of our scholarship has presented a more antagonistic relationship between values, for example, between privacy and health or public health, between autonomy and health. And my personal concern is that in that form, that framing of competition is not very constructive. So hopefully in that guidance, we were able not to take that kind of have that direction. So in our guidance, we identified 17 principles that you can look at the document. I'm just going to highlight a few that they're prominent: the protection of privacy, the value of voluntariness in using the technologies, particularly the technology in question here was digital proximity tracking, proportionality, accountability, the importance of limited retention of data that are collected from any system, and particularly that kind of system, the restriction on uses of this data, transparency across the board of development and deployment and other concerns, explainability, and you just mentioned the relevance of automated decisions in some of those systems, independent oversight, and engagement with civil society. And I'm happy to discuss those more in the Q&A session. I'll invite you all to take a look at the document, and also please note that this is an interim guidance. As things develop and we acquire more experience and knowledge, guidance will be adapting. Now, from my experience with this group, my work in the Swiss Science Task Force that is mandated with advising this government on COVID-related matters, and more importantly, in my capacity as an academic working in bioethics and digital health ethics for quite some time, I'm just going to share with you 3 points that I think are very relevant and I'm actually concerned about. Now, the first one is the focus and attention that digital tools have received recently as a means of responding to the pandemic, and particularly as a means that will allow us to almost live with the virus until we're able to have a vaccine or some other form of immunity if we'll get there. So while I actually believe that digital tools can play an important role in this response, seeing them or presenting them as this one solution to our challenges is problematic for a number of reasons. First, these technologies play mostly an assistive role to standard public health measures, and therefore it's hard to imagine them divorced from other measures that we should be paying attention. I think of them as a tool in the toolbox of our response, and they should be embedded in programs alongside measures that should not be getting less attention, and these are measures that traditionally have worked in public health. The worry, therefore, is that of inflated expectations from technology and the shift of focus or potentially of resources even from more traditional measures that need to be in tandem with the technology. Now, the other worry is that by exaggerating expectations from these digital tools, we might actually be more inclined to make allowances for them that we would not have made had our expectations about their potential were more proportional to the role they can play. A further reason, I think, for which this attention to digital technology is important is that we actually do not have evidence of their efficacy. And that's an important issue that we also touched upon in the report, WHO report, and others have discussed. And actually, to be clear, I don't believe that under the current circumstances, we should be sitting around doing nothing because we don't have the perfect kind of evidence that we have about the efficacy that we'd like to have. But I think it's important to be mindful of the fact that we don't exactly know how these technologies are going to perform and what exactly they're going to do. And also that their performance and their efficacy is dependent on a number of variables. From whether an app performs well in technical terms to whether in a particular constellation it's going to reduce transmission is a long way, and these are things that we'll be finding out as we're going along. So I guess my point is that it is okay and it's important to be confident, but I'm concerned when we're becoming arrogant about these kinds of tools. Which leads me to my next point, which is how these novel digital public health tools can actually earn the trust of the publics all of us that will be asked and will be recommended and asked to use them. And here I'd like to make 2 points. I don't think we can so easily assume that public health efforts and state response, particular kinds of responses, are by default trustworthy. I think that in many countries, how states chose to respond to this pandemic has had an effect on whether the publics are actually trusting them. And I think assuming that legitimacy of an actor means automatically trustworthiness of the program that this actor is putting forward, it might be misleading. Running on trust that was earned at some point for some good reason, it should not be taken for granted. And I think any new intervention has to earn it. And for that reason, being transparent about what we know as to what these tools can do is important. How the tools protect our privacy, how we protect abuse from data collections, and those who might have power over individuals and communities are clearly crucial, including other boundaries about implementations of uses, retention of data, etc. So we have seen that in different countries, people have expressed different kinds of preferences to whom they would trust for these kinds of tools. And we've seen a variety of views. Now, again, we know that we have only registered responses in polls about willingness of people for something that might come, which could be different from what people are actually doing when they're in front of the decision. But the important point here, I think, is that we need to combine legitimacy of the actor with trustworthiness of the product and what's on offer in order for that to work in the public's interest. And I'm coming to my last point, which is that of the independent oversight that the systems like this, like the proximity tracking or other digital tools, will need, I believe, in order to, for a number of reasons. And I'm actually very pleased that the need for independent oversight as a principle has made it to the list of principles that WHO recommends. And I'm hoping that people who are actors who are in the process of developing such technologies and deploying them will take this very seriously. Now, why is oversight important? I mean, in general, oversight is important, particularly here. First, because as I argued earlier, we do know little about these systems and how they're going to work and perform. We don't have the luxury of collecting the desirable quality and amount of evidence that would have helped us make decisions. So we need to be monitoring their performance and their impact very closely. We also have to closely monitor what they do beyond the desirable endpoint of breaking transmission chains, which is the purpose most of them are going to be used for. We need to look in what other ways they impact people's lives and their liberties. And I believe that these have to be done by independent oversight boards or systems, those who are not going to have any political gain or any commercial gain from the performance or lack of these technologies. And oversight of this kind will be crucial for accountability, which I think is in demand, and it's very important. And accountability, the kind of accountability that is important for all actors that are involved in these new systems. And the stakes are very high for all actors. So again, the system of accountability and what oversight can offer to that will be crucial. So I think I've run through my 10 minutes. So I'll stop here and back to you, Mike.
Great, thank you very much, Effy. That was really, really interesting. I'm looking forward to the discussion. So just a quick reminder to the people who are listening here, it would be fantastic if you could enter some questions on the chat line. You need to do that in a way that you select the destination of your chat, so it's panelists and attendees. But please do get your questions in along the way so that I can ask those at the end. So now what I'm going to do is hand over to Joe, who's our final speaker. Joe.
Thanks, Mike, and thanks for inviting me this morning, evening, or afternoon, wherever you are in the world. It's a pleasure to be with everyone today, and my remarks are going to build off of Effy's largely. And so I'll be speaking to ethics of digital health with a focus as well on proximity tracking or digital contact tracing or other types of technologies that are seeking to approximate digital contact tracing. But let me begin with just a brief acknowledgement that there are a lot of different examples out there of digital technologies being used during the COVID-19 pandemic. We heard about the use of facial recognition in China, supported by machine learning technologies, and but there are a number of others, including various types of active surveillance technologies, where we're using mobile phones or other network devices to support surveillance, disease surveillance, symptom tracking, behavior tracking, and the like, either through apps or through wearables, through text messaging, SMS, interactive voice response, robocalling, other types of technology. There's also, as Effy was saying, digital contact tracing efforts or exposure notification technologies using apps and API, and I'll spend a bit of time talking about that in a moment. There are also passive surveillance activities, so other types of digital data mining activities involving individual information or aggregate information that's available, where oftentimes those data points are triangulated in order to get a better understanding of disease transmission or other types of characteristics. And then we see a range of clinical technologies. So obviously everyone knows that clinical providers, healthcare providers are using telehealth more and more these days, but during the pandemic even more so. We've seen a sort of explosion of the use of mental health chatbots. Robotic sort of automatic response programs that are oftentimes driven by some sort of machine learning technology, where individuals can consult with those chatbots through their mobile phones in order to get sort of mental health related support. And then efforts underway to coordinate sharing of clinical case data between healthcare workers and providers for case management of COVID-19 through platforms. And then finally, more recently, we've seen some even social media companies and others intervening in communications through social media to manage what WHO and others have referred to as infodemic, so the spread of false or misleading information through social media. So there's a wide range of examples out there. And we're obviously not going to be able to do service to all of these today, but just wanted to note that. Similarly, in this terrain of digital technology development for COVID-19 and pandemics and more generally, it's really important to appreciate, and I think many do, that it focuses solely on the technology and the production of the technology and its capabilities is not going to be sufficient for responsible digital development. So we have to have a really good grasp of the science of what COVID-19 and SARS-CoV-2 is and how it transmits and acts within the world. We have to look at the performance of those technologies, as Professor Vayena was mentioning, that the information about data that we can collect about effectiveness to the extent that we can. We have to look carefully at the various legal issues in different jurisdictions. Of course, the public health needs have to be front and center to see whether or not the technologies are designed in a way that meets those needs. And then public adoption and acceptance. Another thing that Professor Vayena was mentioning is critical. If people aren't going to use the technology in the way it's intended, it's not going to have the desired effect. So a range of considerations, including ethics, need to be taken into account. And the challenge right now is that the world is changing rapidly. Understanding of these different things is changing rapidly, and there's a lot of uncertainty. So it's not an easy thing. So a group of us at Johns Hopkins, as well as a consensus group of individuals, both from within and outside Johns Hopkins, recently focused in specifically on digital contact tracing technologies or associated technologies such as proximity event tracking, to develop a comprehensive report that brings together public health, technology, ethics, legal, and policy perspectives to provide in-depth analysis and concrete recommendations to support the effective and informed and responsible development of these technologies, with a focus on the US, given that our analysis included legal considerations as well, which can be quite contextual. So this book, for anyone who's interested, is available to download for free. And I think Catherine has shared the link for everyone who's interested. And I'd encourage folks to have a look. It was recently published just last week. So we looked at these various considerations, and we started with ethical values and principles. It's helpful sometimes to look for those guideposts to inform recommendations that are actually sort of designed in a way to be comprehensive. And we developed these principles in a way that they are sort of forward-looking. They do focus on the use of digital contact tracing technologies, but they're designed in a way that they should be applicable to any digital public health technology that's used for pandemic response. So let me just quickly introduce these 5 principles, which are guiding the work that we conducted and we think should guide other work in this area. The first speaks to this concept of transparency and public engagement as being essential to inclusive digital public health responses. The second focuses on the need to develop technologies in a way that least infringe on civil liberties, including privacy, but also other civil liberties, in order to accomplish the desired public health goals. The third, focuses on the need for technology development and use to be guided by the best available evidence. Again, acknowledging that it can be difficult to collect evidence when technologies are being developed rapidly in the context of a pandemic, but at least there should be some requirement in place related to the collection and analysis of those data. And then the fourth, as I think Effy made clear, sort of focuses on the responsible use of digital technology requiring meaningful governance and accountability, including mechanisms for oversight. And then lastly, our report highlights in its 5th principle, the need for the deployment of digital technology to be rooted in a commitment to equity. So I'm going to sort of refer back to these a little bit in the remainder of my talk. But I'm going to focus in on one particular area or issue that relates to how we realize these principles. And this is one of the sort of many issues that were discussed in the report that I just mentioned. So I'm going to focus on how we have to go about ethically designing these digital technologies with a focus again on digital contact tracing technology. So let me just begin by a quick one-slide overview of what many of you may already know, but I think it's important to remind ourselves about what contact tracing is. So it's a core public health tool that's existed for a long time, and that involves identifying infected persons as COVID-19 cases, identifying the close contacts of those cases, getting in touch with those contacts, so having information that permits you to actually contact individuals, having their phone numbers, maybe their addresses, maybe their information about their places of work, so that you can reach them. Asking those contacts to take certain protective measures. For example, in the context of COVID-19, it might be quarantining at home for about 14 days. Assessing contacts for possible symptoms, and then following up those cases and contacts to identify new or worsening symptoms and connecting them with care if needed. So the challenge, as we all know, is that we don't currently have enough manual contact tracing capabilities. Our public health systems are stretched, and there are efforts underway to try to train individuals, including through a free course that's on Coursera that Johns Hopkins developed recently, and it's available for anyone who's interested. But we still don't yet have enough capacity. So as a result, partly because of that, we've seen a lot of different potential digital solutions emerge globally, and they've taken on many, many different forms. So I know this chart is a little bit complex. It's in the book, the report as well. You're welcome to have a look at it there. I'm not going to focus in too much depth right now, but just to say that there's a wide range of technologies being developed and currently in use to support digital contact tracing. We've loosely grouped them into 3 broad categories of those that we call sort of maximal interventions, middle ground interventions, and minimal. And those 3 categories sort of are suggestive of the degree to which these different technologies either store data centrally or in a decentralized fashion, degree to which whether or not the government has access to certain identifiable information, and other characteristics such as whether or not geolocation data are being collected or not. So things at the minimal end of the spectrum tend to be more decentralized, tend to collect and store the identifiable information sort of in a very limited way, and tend not to loop in or connect public health authorities into those systems to share those data. So they're really designed for the user, not so much for the public health system. So in response to a lot of these different technologies, of course, we've seen a lot of different reactions in the popular press and many, many surveys and public opinion polls and other things and the like. But there is this dominant focus on privacy, and we see this in the news, we see this in academic reports. We also see it in the United States in two US congressional bills that were introduced by the Senate, focusing on data protection and privacy. And we also hear a lot about this concept of privacy by design. So when you think about designing technologies, there's a sort of often referred to approach which seeks to preserve privacy or maximally preserve privacy. And privacy by design, which was articulated in 2010, shares 7 different principles, which include and focus predominantly on building privacy and security protections into the actual design of technology, rather than counting on responsible use alone. So systems such as the sort of very popular, commonly referred to Apple, Google application or API, focus on this and claim to embrace this through their decentralized privacy preserving proximity tracking systems. And as a result of their interpretation, I think, of this privacy by design framework, they've developed a very minimal system that relies to a very limited degree on integration of public health authorities. So it's not the same thing as the contact tracing that I referred to previously, where public health authorities are connected to cases and to suspected cases and contacts, in addition, in a way that allows them to be able to reach out and communicate with those contacts. So I'll come back to that in a moment. But I think it's also important to acknowledge, and I think this has been discussed less so in circles, is that privacy by design embraces this idea of there being legitimate non-privacy objectives, and it accommodates those in an innovative, positive sum manner. So this, I think, is very consonant with what Professor Vayena was just mentioning about thinking about being constructive when we design these technologies to be sort of simpatico with goals such as privacy and values such as privacy. But it raises a question, I think, for many of us, is how do we identify legitimate non-privacy objectives? So I think we should, and we do, look to other things we value. So what are those things? Well, for example, I think many of us value our physical and mental health. We value companionship, certainly now. We value economic well-being. We value efficiency in the public health response. We value equity. We value autonomy, and many value patriotism or solidarity. And it's important to acknowledge that we have this wide range of values, but our values often change, and the way the priority and weight we give to those values changes when circumstances change. So the pandemic, if nothing else, has taught us this. And I think we all know that it's very difficult to realize many of these values, which we could more readily realize prior to the pandemic. And it's really, aside from physical privacy, many of these are very challenged. So I think this calls for a need for better alignment between a number of different things. So first, we need to enable an effective and efficient public health response. We also need to protect individual privacy and prevent various other potential harms. We need, at the same time, to allow for individuals to realize other values that they believe to be important. We need to promote the equitable distribution and benefits, the equitable distribution of benefits and burdens of surveillance technologies. And we need to maintain public trust in the technology and in the public health response, all while taking seriously the future implications of the decisions we make today. So what Professor Zeng was referring to earlier about should these technologies be used in various other ways future, we need to ensure that we've taken that seriously. So how do we do this? I think it requires very hard and difficult work, but it's important work about appropriately balancing competing values and interests and capabilities with the technology, architectures, and systems of governance. So it's about the technology itself and how we design it. and about how we oversee it. And we have to start, I think, on the right foot. So we propose that technology developers and others ought to take this sort of values in design approach rather than a privacy by design approach, which allows for the incorporation of a wider range of values into the technology. Technology companies alone, we argue, should not control the terms and conditions or capabilities of digital contact tracing technologies, nor should they presume how to know what is acceptable to members of the public. There's an important question about who ought to be involved in designing technologies and in setting those value priorities. So we recommend a robust public and user engagement process that includes incorporating a wide range of views and perspectives, including those who are technologically and digitally marginalized within communities. We also suggest that technology design should not be static. There isn't sort of one design that will solve all problems, and technology is not itself, as Professor Vayena mentioned, not going to solve all problems. But we should design technologies capable of evolving as conditions change, as local capabilities and needs change, and as preferences and priorities change. And then finally, digital contact tracing technology should be designed to have a sort of base set of features that certainly protect privacy, but there should be layers of additional capabilities that users can, for example, choose to activate. And that might include things like location data sharing, if and when that's proven to be actually supportive of public health response capabilities. So individuals should be able to opt into some of those capabilities, again, guided by best available evidence. So that's sort of the end of my remarks for today, but I'm happy to discuss a range of different issues, I think, that have been raised by others as well as implicit in this talk. But I just wanted to acknowledge the various contributors, including Mike and Professor Vayena, who have contributed to this work. So we have a number of colleagues who are lead authors on the report that was recently published, as well as a number of contributors, again, from both within and outside of Johns Hopkins, who provided incredible insight in developing this work. So thanks very much.
Thanks very much, Joe, and thanks for 3 really fantastic talks. A really, really exciting topic and very, very timely, really interesting and so challenging and hard to get hold of and understand. And you've all done a fantastic job of helping us to understand what these issues are. So there are a lot of questions and everything in the chat line, but what I'm going to try to do is, what I have tried to do is pick out a couple. Sorry about the ambulance in my background there. So try to pick out a couple which I think will you know, the people on the panelists can have something to say about. I suppose a lot of the questions focus on the question of the kind of ideal world and the real world. So both in terms of the technologies, you know, their design, how they're actually going to work in practice, but also in terms of ethics, you know, well, we've come up with these theories and these frameworks, how are those going to work in practice? So a lot of the questions relate to that difference between the real world and what we'd like, the world we'd like to be in. And maybe the first one was the first set of questions are to do with the idea of independent oversight and accountability, which several of you, or all of you mentioned. So on the one hand, we've got this idea that what we really need is independent oversight and a trusted oversight, which seems a really important thing. And then we've got some of the people commenting have said, this is just a way of justifying governments, you know, will do what they want to do. This is just a kind of a cover for that. And that what we should really focus on is what's the right thing to do. Should we be doing this surveillance anyway, irrespective of whether a committee thinks it's the right thing? So I guess it's about the relationship between a trusted and independent oversight and kind of firm moral principles on the other hand, on the other extreme. So, I mean, maybe that's a broad area, but not really a question, but maybe Effy, I don't know whether you want to have a go at saying something about that.
I'll try.
The rest of you.
I saw the question as well, and it's, you know, the ideal versus what is feasible actually in reality, in the real world. But well, I think even because there is this gap between the ideal and the real world, I think it's even more important to stress that that kind of oversight has to be independent, and all of the actors that are involved. I mean, at this point, it's not just the government that are doing something, right? We have multiple actors that are in the game. And so that's where we can all demand that the oversight, first of all, is there, and second of all, it is have the right composition and the right mandate. I don't know how we can enforce that. I mean, I don't have that, you know, magic recipe, but I think it is important to stress it in the form of recommendations that come from WHO, that come from the work that my colleagues at Johns Hopkins did, and from everywhere else. So the message has to be out there that this is how it should be, and the public should also demand it. That's how I can see this happening. I don't think it's the time to discount now and say, well, okay, well, we're under these circumstances, so let's not do it this way. Let's just do it in whatever way, because it has to be done.
Yi or Joe, would you like to say something about this? Joe.
Sure. Yeah, sure. I'm happy to. So I agree with Effy entirely. I think we need independent oversight for a number of reasons. And you know, from a public health perspective, if the technology is actually proving to be effective, independent oversight as well as strong sort of regulatory systems and governance structures can help support public trust. But they have to be accompanied by transparency in order for members of the public to be able to appreciate what those independent oversight bodies are doing and to what extent they're meeting their stated objectives. And we also need transparency about how data are being used, not only to help support trust, but also for individuals to be able to understand whether or not the data are being used in a way that that actually does contribute to that public health goal. I think there's also a potential case to be made for systems of governance to include opportunities for individuals to sort of present their own data in a way that maybe, like, for example, if there is some sort of misinterpretation of those data, if somebody's identified as having been in proximity with another individual, and yet they know they were on a bus moving by an individual when that proximity event was detected, and therefore a very low chance that there actually was transmission of a virus. If they have geolocation data available to them showing their movements at that time, and then it locates them on a moving vehicle, then those information, if available to a user, might be helpful in avoiding a 14-day quarantine or other measure that might be liberty limiting or other restrictive events. So I think there's independent oversight. There's also sort of the need to develop into these systems mechanism for individuals to provide their own sort of control and ability to do some sort of cross-checking of data when that's important.
Did you want to say that?
Right. I might want to add, following what Effy says about the public, just bring back to the example for the Hangzhou health code, the new version of it that they would like to try, but they never start. But actually, it is the public saying that, hey, this is really against what the national Ministry of Healthcare says, and you cannot actually do it. And I think from the government side, they're kind of at the very starting point, they're kind of observers saying, okay, let's see what is the people's reaction, and nobody are actually happy about it. So I would say that for independent oversight, that the general public's idea is very quick and very massive. Like what I've been exploring is a news that are with 8,000 feedback saying no. So that's something that count.
We had a lot of questions. I've probably got time for 2 questions. But we had a lot of questions, comments from Talia Arawi and other people saying, and which relates to that last point. And in your talk, you talked about, well, the potential for these technologies to be used for uses beyond the ones that we're currently kind of authorizing or talking about, and how we can protect against that. How can we stop it is the question. And the comments so far have focused on the role of the public, the role of people to kind of say we're not happy with this. But well, at least I don't know what Switzerland's like, but certainly in the rest of our countries, we're used to we're living with governments that don't necessarily always do what the public is in the interest of the public. So how realistic is it that people are going to be able to control this? Don't we need stronger controls than that?
Sorry. You mentioned Switzerland, so I thought I'll talk.
Well, I thought you might be the exception in Switzerland to this.
Well, we are in direct, we're practicing direct democracy here, so we're used to having the people say what they want to do about everything. So, but I understand it might be an exception and not the rule. That's even more of a reason I think that these technologies can actually quickly resemble or the wishes of the people. So the uptake of a particular technology, right, can be whether people are going to first use it, but also whether they will sustainably will continue using it, can tell you a lot about what they want. Yeah. And so why not then introducing technologies that they're built in the system of dismantled if people don't want to use them, and they might have the right reasons for not wanting to use them. I think, yes, because we don't have incredibly successful everywhere systems where people's voices will be heard. First, it might not be an opportunity to just do it right this time, but also even more of a reason to have technologies that are not intrusive and pervasive in ways that we have that individuals then will have no control over whatsoever. So for me, it would go this way.
So we've got a couple of minutes left here. Building on this, so a lot of countries are either already using these technologies or planning to use them very quickly. What do you think, bearing all these things in mind, what do you think the role of ethicists is? What should we be doing? What should we be doing now? What's our role, as it were, for the future? How can we, what's our job? Joe, do you want to go first?
Sure. Well, I think we're doing part of our job right now. We're trying to communicate about how this technology works in a way that is public, and how the sort of risks of using this technology in certain ways. I think we as ethicists sometimes have this kind of unique positionality where we have an ability to sort of be connected to individuals who are developing who are on the front lines of the science, who have a good understanding of the public health issues and needs, who are developing the technology, and to the public who have certain concerns about the technology. And so I think our work is in many cases largely translational, and we can serve in that function, I think now, in the work we're doing to sort of unpack the various issues and show sort of what those public health needs are, and whether or not the technology is aligned with those public health needs, what concerns the public are bringing to the table, and what needs the public has, so that we can, again, try to best align those capabilities across the various worlds.
Great. I think that's a good way of putting it. I mean, hopefully this event has contributed in some ways to that. I just want to make sure I finish on time, or more or less, because I know people have other things to do and people are in different parts of the world and different times of the day. We've had a lot of questions that we weren't able to answer. We had a lot to do with the relationship between Google and Apple and governments. We had a lot about facial recognition, about privacy, about equity. We obviously can't go into all of those, but they're all really important topics, and they were covered to some extent in each of the talks. So I hope that those of you who have the opportunity, will go and listen to these talks again when they appear online, and look at the other resources which address some of those issues. I want now to thank all of our speakers for great talks, and I'm looking forward to seeing you all again soon. So thanks very much, everyone.